Hello, everyone. My name is Abu. I'm with my colleague, Elizabeth. This is a public service announcement for our ADN nursing students. We want to talk about the HITECH Act. What is the HITECH Act? When did the HITECH Act come into effect? HITECH Act and the ADN nurses scope of practice, and the HITECH Act with HIPAA for personal cell phone use, social media for the bedside nurse.
The definition of HITECH is that it's a policy established to increase the adoption of electronic health records. Significant commitment of federal resources and incentives are in place to support the widespread adoption of electronic health records, or EHRs. This was included in the Affordable Care Act in 2009. CMS was a strong factor in the implementation of EHRs into hospitals and medical facilities. They designed 3 stages of the implementation requirements and named them meaningful use. What we have seen in our research is that stage 3 is the stage that affects nurses the most. Although they are using it through all 3 stages as far as documentation and their assessments. Stage 3, when they are looking at the improved outcomes and patient care plans, is when they're most effective. So as an ADN nurse in your scope of practice, what does a HITECH Act affect you? The most times that you'll be using it is at your bedside when you're doing your barcode medication administrations. As you see here, the nurse is scanning the medication and then will scan the patient's wristband as a second way of verifying the 5 rights of medication. The workaround warning. We're warning because there's now being seen that nurses are able to work around this actual second form of safety in administering medications, which can cause medication errors.
HITECH Act and HIPAA prohibits electronic protected health information to be transmitted through open networks that are not encrypted. We all know we are prevalent with using our personal devices, but for an ADN nurse, you make sure that you do not use your personal cell phone to look up patients that you don't have any direct care with, or take pictures and post them on social media. The ultimate 5 goals of the HITECH Act is to improve the quality of patient care, efficient patient care while ensuring privacy and security is in place for our patients, because we are entrusted to keep their personal health information private, and also to engage patients in their own care. Patients teaching is important, and patients have their own personal health records on their phones nowadays with MyChart. The goal is to also increase coordination of care and ultimately improve the health status of the general population at large.
Thank you so much for this PSA.